So, man.
How's it going, Herman? We do have 5 members now. You're welcome to wait a few more minutes or call the meeting to order, whatever you prefer. We have, let me get the agenda on the screen too before you.
Okay, so let me stop
We don't
sharing.
really need the agenda on the screen. We don't need the agenda on the screen. Just, I'd go back to your slides. We might want to take roll though, so let me at least get the roll.
Okay. Well, then it's after 3 o'clock. Let's go ahead and officially call the meeting to order. And the first order of business is, did you want to make your statement first, Colin, or do we want to take roll first and then?
Yes, and I am going to put the agenda on here for just a minute, if you don't mind, and then we can go back and you can have it. Yeah, so I just wanted to let everyone know if there's any members of the public on here. I don't see too many. But the last meeting, this meeting is essentially will serve as a remedy for the last meeting. We didn't vote on anything, so there was no official action, but the links to Zoom were wrong, so some of the public wasn't able to get on, and I didn't figure that out till the end of the meeting. And so I asked Bob what the remedy was, and he said, well, just have another meeting, which we'd already scheduled anyway. So just for the record, this meeting serves as a remedy for any sunshine violation that may have inadvertently happened at the last meeting. So with that, Mr. Chair, I can call the roll if you'd like.
Yeah, let's call the roll.
Okay. Dr. Snyder? Dr. Conroy? Oh, I see Dr. Snyder. Dr. Snyder's here. Dr. Conroy?
Here.
Dr. Knopf is here. Deidre Houchen is not here. She emailed and said she wouldn't be able to be here. Dr. Labarda?
I'm here.
Is here. Dr. Gurka, I don't think is here. Dr. Busey, I don't think is here. Is Patricia Carroll here? Okay, not here. Roger Doles? No, Doles is a no. Dr. Brown, Naima Brown.
I'm here.
Here.
I'm here.
And I see Dr. Fogarty is here.
Here.
Dr. Resende. I don't see Dr. Resende here. And Jeff Feller. Not here. Okay, we have 1, 2, 3, 4, 5, 6 official members of the committee, so we have a quorum. And the next item would be the minutes.
Is there a motion to approve the minutes?
I'll move to approve the minutes.
Second?
I'll second them.
Maureen has it.
Is there any discussion? Hearing none, we'll call the vote. All in favor of approving the minutes?
Aye. Aye. Aye.
Any opposed?
All right.
Hearing none, minutes are approved.
And you can go back to your screen now, Herman.
Okay, you have to stop sharing and then I'll be able to share.
Okay. I have to stop sharing.
Top of the screen in green.
Okay, it says we're stop sharing and say, okay, got it. Thank you.
All right, so I'd like to thank everybody for joining us for an extra Friday afternoon meeting. I'll hopefully go through this efficiently so that we can get any feedback on what I will be sharing with the trust on Monday, and then approve this deliverable before we submit it to the trust on Monday.
Herman, similar
Yes.
to a defense, how would you prefer that we proceed? Do you want to do the presentation and we'll just note some things, or do you want us to interrupt along the way? Probably it's up to you, but just wanted to check in about process.
Yeah, why don't we interrupt along the way so that the slide will be up as you guys have feedback rather than trying to then find the slide again later on.
Okay.
Would you also like the feedback in a form of a chat? Because I think that creates an easy written record if those remain. Colin, do those remain? Would that help, Herman, to have just a chat so you're not constantly having to take notes?
Yeah, that would be an excellent suggestion. Thank you, Maggie. This is a presentation of the work of the Technical Advisory Committee being presented to the Children's Trust of Alachua County's Board of Directors. We're given a charge to provide support to the Children's Trust of Alachua County's future strengths and needs assessment for children ages birth to 18 by synthesizing existing reports and data to identify information that can and should be used in identifying community strengths and needs, and to identify important areas currently lacking comprehensive information that need additional data collection. We've consulted with the executive director to prepare this short report of key findings that we're sharing with the board today. Our committee was constituted by the individuals that you see on the screen. As you can see, that we had a diverse group of community members that represented both the University of Florida, Santa Fe College, as well as other agencies and organizations that support children and families in Alachua County. In addition to those formal committee members, our work was supported extensively by Cindy Bishop from the Alachua County staff, Colin Murphy from the Children's Trust, and Maya Schreiber, a graduate student with UF Anita's Upper Center. As a refresher from Colin's presentation at the last Children's Trust board meeting, our work has been guided by the results-based accountability framework as described by Mark Friedman. Our work was to first identify the results or the outcomes that the Children's Trust is working to achieve. And then we worked with the available data sources and information to identify meaningful indicators that would help us to define whether or not we're achieving results that we're intending in Alachua County that might serve as good baselines to measure future efforts and activities to support the overall well-being of young children and families in Alachua County. And I'm trying to push to the next slide, and for some reason this one, there we go. To help provide some scaffold for the definitions and key terms that we used as we were going through our work. The Technical Advisory Committee has focused on the left side of this diagram, identifying first the result areas or condition of well-being for children, adults, families, or communities. And then we worked through available data and information to identify indicators that could be used to measure whether or not we're achieving our results in Alachua County. The right side of this diagram shows program and program performance measures that will be used or should be used to measure whether or not programs funded by the Children's Trust are achieving the desired outcomes that will be relating to the indicators and the results areas identified by the Trust. In completion of this work, our committee held bi-monthly meetings to discuss and identify a framework for for meaningful results, indicators, and data that could be used by the Children's Trust Board of Directors to understand and respond to the needs and well-being of children and families in Alachua County. All members on this committee, outside of scheduled committee meetings, collected and prepared resources and data to present to the committee for consideration and inclusion in our final deliverable. After extensive review and this deliberation, the committee has identified 4 key results areas that answer the question that children in Alachua County are effectively supported when all children are born healthy and remain healthy, all children can learn what they need to be successful, all children have nurturing, supportive caregivers and relationships, and all children live in a safe community. Early in our discussions, we had identified a 5th result area, all children are connecting with and contributing to the community. But after continued discussion and deliberation, it seemed more appropriate that this be considered or classified as a program characteristic, where program performance data should be collected to inform whether or not youths or children have opportunities to develop participation roles and have opportunities for leadership roles in the community, whether or not youths develop the ability to have agency and to build new skills, whether or not LGBTQIA youth needs and other needs associated with sexuality and gender are being attended to, whether or not children are referred for problems interacting with peers, and the extent to which teens are involved in extracurricular and enriching activities. Does that kind of work for you guys? Because we had a lot of discussion about this at the end of our meeting last. Got a thumbs up from Maggie. And I've included some insight. Yep.
Can we just back up 1 second?
Sure.
One minor suggestion for wording that might perhaps be helpful is to make it a little bit more conditional on that slide. So rather than while initially considered a result, this might be more appropriately classified as a program characteristic.
And then I'd just add the last bullet, instead of teens in extracurricular, teens involved in. It's what you said, so I just think it adds meaning to that.
Thank you both. And I've included some key insights, both at the beginning, and I've included these same insights again at the end of the presentation. And I included it at the beginning to call their attention to critical data points as we go through the rest of the presentation, but would certainly love feedback from the group on whether or not it would be appropriate to just save all this for the end, or if it does serve as a nice advanced organizer. And to generate these insights, I went, as I was going through the data, tried to identify some key points that we would want the trust to come away with. And this is all certainly, in my mind right now, a draft, but I think that it captures much of our discussion that we've had to this point. So the first is that in Alachua County, there are significant racial disparities in all result areas. While the percentage of children with health insurance in Alachua County is higher than the state rate, several indicators of health show a need for closer examination. For example, infant death rates, child obesity, and sexually transmitted disease rates, which would require a closer examination of the health status of children in Alachua County. Access to quality early childhood experiences is an issue, particularly in East Alachua County. This is reflected in maps of access and kindergarten readiness rates. Florida sponsors VPK supports for 4 to 5-year-old children, but supports for younger children are missing from our system. Access to information about socially and academically beneficial programs for children ages 5 to 18 is limited. Rates of youth arrested, STDs among 13 to 20 age teens, and continued educational disparities highlight a need for further investigation, supports, and programming. And finally, everything that we think that we know about systems of support will be challenged due to the current public health crisis.
I think those are excellent. I think that's really helpful from my perspective to kind of set the stage.
Herman, the only thing I would say also is that we might want to talk about the fact that these things all point to not just programmatic access to services, but perhaps structural issues that need to be addressed.
Yeah, that's a great suggestion, Maggie.
I agree, Maggie. So not just programmatic access, but structural barriers.
Yes.
Okay.
And I'm actually doing a chat, so you have it.
Okay, thank you. And I'm kind of thinking that I would want to include that in the first bullet. Because I think that it applies to all of the following bullets. So this report, the committee includes indicators that can be tracked over time to understand children's well-being in Alachua County. Through our work, the committee also located existing resources which are produced annually that can be used to help track many of these recommended indicators. And these are links to both the child health status profile as well as the school-aged child and adolescent profile that includes many of the indicators and are searchable by county and date. Throughout the presentation, any of our indicators that have an asterisk next to it indicates that the measures have that we've included here have a corresponding measure in the Department of Health profiles and can be used to track progress annually. The DOH profiles include a performance rating for each indicator reflected in quartiles. The first quartile is good, the fourth quartile is bad. Current county performance in these quartiles will be displayed on graphs when they are available. This is our attempt at a dashboard. And so based on our discussion, we've pulled out kind of the high leverage, highly communicative indicators and then follow this dashboard with specific indicators for each of the results areas. And so we show here insured children or children who are insured with health insurance in Alachua County. We are continually higher than the state insured rate. We're looking at oral health. And this is based on a screening of third grade students conducted by faculty that were at the dental department at UF. Identified 35% of kids, third graders screened had untreated cavities. The number of untreated cavities broken out by race illustrates that white children and Black children have the highest rate. But once we consider the overall population of Alachua County, Black children are disproportionately represented with the number of untreated cavities. When we look at children with a healthy birth weight, in Alachua County, our numbers lag the state consistently from 2016 through 2018. And then when we look at this percentage by race, we see that African American and other children are of a healthy birth weight less frequently than white children. Access to prenatal care in Alachua County, we tend to lead the state in the proportion of families that are, or proportion of mothers that have access to prenatal care as measured by the Untitled Index. Fetal deaths. Initially in 2016, we had a higher rate per thousand kids in Alachua County, but since then in 2017 and 2018, we have a lower rate of fetal deaths. Here's a listing of all of the other indicators that we have listed, starting with insured children, which we've shared before. Percentage of third graders that have untreated cavities, caries experience or some dental health issues, no obvious problems, need for dental care. Urgent needs is declining slightly over the past 3 years. And then children with sealants, which is an indicator of preventative oral health.
Herman, I think when you switch to these slides, the introduction might be good to say that these are second tier indicator data points rather than the core ones that give us the overall picture, but that these are things that can be monitored, particularly as programs become implemented, to see which of these indicators they affect.
Thank you, Maggie.
And Herman, I think it's just a minor point, but on the first slide, the name of the faculty member at UF, not that one, maybe the second one. No, the oral health ones. That's right, I think Dr. Scott Tamar, but on the ones that follow, I think it's transposed.
Yeah, thank you. It's Tamar. It's Scott Tamar. Thank you, Pat.
Yeah.
And here's our healthy birth weight. And if we look at healthy birth weight by race, we see that our African American or our Black and other children are less frequently of a healthy birth weight as compared to the white population in Alachua County. Our fetal death rates in Alachua County are declining and have switched from being higher than the state average to below the state average for the past 2017 and 2018. Our deaths per 1,000 births, so our sudden unexpected infant deaths are ahead of Florida rates considerably. And when we look at these rates by race, we see that there's a very clear disparity between white children and African American and other children. And the infant death rates, we are ahead of the state for the past 3 years, and in fact have been identified as performing the 4th quartile of all counties in the state of Florida. The student to school nurse ratio in Alachua County is much better than our state student to nurse ratio. And we are showing the 1st quartile of performance in that area. We have a lower birth to teen mother rate with our numbers just above 10 per 1,000 births, which is below the state average, and is also in 1st quartile of performance compared to the state averages. When we look at this breakdown by race, we see a large difference in the rate of white children that are born to a teen mother versus Black and other children born to teen mothers. As we look at our STD rates among 13 to 20-year-olds, we're in the 4th quartile in the state, and have a higher rate compared to the state averages. When we compare whites to Black and other children, we see also that there's a big difference in the rate of incidence of sexually transmitted diseases among 13 to 20-year-olds. Looking at middle school and high school obesity rates, among middle school age children, our obesity rates are higher than the state obesity rates. In high school, they were higher in 2016, but in 2018, our obesity rate among high schoolers fell below the state average. And so in our middle school, we're falling in the 2nd quartile of performance, and high school obesity rates are in the 1st quartile of performance. Additionally, in hospitalizations for self-inflicted injuries, at a rate of 170.2 per 100,000 children, we are 2.4 times higher than the state average, or appearing in the 4th quartile of performance in that area. And then in hospitalizations.
Can I interrupt?
Yep.
Can you go back to that one? I think that's obviously someone is going to just interrupt you right there and say, well, tell me more about that. What is a self-inflicted injury? We probably discussed it, but I'm a poor student. Can you refresh my memory? We know what this is?
This is my interpretation of this, and Maggie, correct me if I'm wrong, but this is a suicide attempt.
It's hard to know if it's just, if it was a legitimate suicide attempt or also self-injurious behavior that is more self-mutilation kinds of things, and which is another growing issue among kids in this age group. But I would imagine to rise to the level of hospitalization, yeah, it would have to be a suicide attempt.
Okay.
And my question about this data, just because I understand how the state collects data, is whether this is coming straight from hospitals or if it's also including crisis stabilization units, which often are not included in hospital data. So the kid might have not made it into the hospital. They might have been cleared at an emergency room. They might have lacerated their wrist, not require hospitalization, gotten stitches, and then been transferred to a crisis stabilization unit. That would probably not be reflected here. So sadly, this number is likely not the real baseline anywhere in the state.
So you're saying it's likely worse than what we're seeing here.
Yeah, but it's worse across the state. In other words, so it's not that we would have fewer or more hospitalizations. It would just mean that if this is only counting children admitted to hospitals, then it is likely missing children that transfer out of an emergency department before they're hospitalized.
And then hospitalizations for eating disorders were 2.28 times higher than the state of Florida.
Yeah, and that's another one that's cautionary. We need to look at Leon County rates. We need to look at places with the universities, because the university population is that's a high risk population age group, and you've got a concentration of them.
Well, would you recommend we not include eating disorders, Maggie, at this time without the comparators for other university towns?
You know, I would just make the comment that probably needs to be looked at in the context of being in a university environment. But no, I think this is another one that's not going. These numbers aren't going down.
No,
The eating disorder treatment programs are down anymore. UF used to have one.
and I think eating disorders it contains many different types. Like we think of the binge eating disorder. Anorexia is probably the most deadly. So we would see that bulimia and the health effects there on the GI and oral health systems. But binge eating disorder is also known and most common, but I'm not sure about hospitalizations for that specifically at this age.
Well, yeah, especially since, like I said, so what you're looking at is hospitalizations for the secondary effects of the disorder, right? So you are bulimic and you get your electrolytes so out of whack because that you now have heart issues and you have all kinds of everything else. I don't know what this tells us, you know, because again, you're looking at hospitalizations that are medical related to having an eating disorder. You're not looking at hospitalizations for treatment of an eating disorder because there is none here. There's no such. And the state has very few. I will tell you that having worked around planning for insurance costs and as on the insurer side, this scares insurers more than just about any other childhood disorder, because one eating disorder child can just cost an outrageous amount of money. So
that would be good to mention.
I would also ask that we keep it because it's so much higher than the state rate, and the age is 12 to 18. And while some students may go to the University of Florida at 17, I still think that this is not our college age population for the most part. There's something going on here, and I think we would be remiss if we left it off.
Yeah, I don't disagree. I just don't know what it tells us other than that, you know, that could be access to hospital care. It could be, I don't know what it says. I mean, I could go either way. I'm just not sure it's a high level enough measure that it's one we want to focus on. Just my 2 cents on that one.
Well, I'll keep it, and if this is something the trust decides that they want to dive into, there's a lot of story behind the story detail and investigative work that'll need to happen before you're able to identify any interventions. And then there were several items that we included on our data development agenda, which included information about children, that whether or not children can regulate their emotions and behavior, the number of children referred to mental health services and are able to access said services, schools offering physical education or a period of physical activity to all students. What's this one? I can't. All my windows are clogging up. Pre-K children who can self-regulate and communicate their emotions and feelings. Young children who are of a healthy weight, and physical activity available to youth during out-of-school programs.
Herman, I think, I'm
yep.
sure because we interrupted, if you were going in the flow, I think you probably would have said, but I think it'll just be important to explain to people what we mean by what a data development agenda is. Just take a little time to explain what we mean by that.
Yeah, and that, the items on our data development agenda are pieces of data or information that we need to know more about, but are not necessarily easy to capture data on, and will take dedicated time and effort to identify or potentially even construct measures that will enable us to capture this information to guide future decision making.
And some of them may be relegated to, some of them may be elevated to an indicator level, and others may be performance measures that come out. I think that's what we said. Is that right? That we,
yes.
we just, because if we could figure out how to measure some of them and they could rise to an indicator level, that would be great. But we may not be able, we may have to have them as performance measures that inform some of the higher level indicator results.
That's an important point, Pat. Thank you. Now looking at all children can learn what they need to be successful. Some of the higher level dashboard indicators that we are looking at are graduation rates in Alachua County, both looking at Alachua County performance, which tends to lead our state rates, but then also looking at the graduation rates broken down by race, and where we see that Black children are graduating at a much lower rate than our Asian, white, Hispanic, and children who are identified as having multiple races. What's the top of this one? This donut figure shows the proportion of children who have utilized the voluntary pre-kindergarten program in Alachua County, where we're sitting at just under 76% of children enrolled in kindergarten accessing the PPK program. And then looking at the percentages of the absentee rate of kids who have been absent 21 days or more. In the 2015-16 school year, we had 13.9%. In the 16-17 school year, that number had dropped down to 6.36%. In the 17-18 school year, it's back up to 11.8%. Next, I skipped. The ELA scores are looking at third grade and 8th grade performance, and I'll have more explanation about what the level 3 versus level 4 performance means on ELA and math. But as we can see just on this first look, in both 3rd and 8th grade, our Black children are proficient at 30% at level 3, and then down to around 10% on level 4, whereas our white students are just below 80% proficiency in 2018-19 at level 3 and almost just above 50% in level 4, which highlights a significant disparity in educational outcomes for children in Alachua County. The indicators that we're presenting related to this results area include childcare accessibility, children enrolled in BPK, kindergarten readiness, and then among school age, we have the FSA for ELA at 3rd, 8th, and 10th grades, FSA at math for 3rd and 8th grades, out of school suspensions, students absent 21 days or more from school, and our high school graduation rates. When looking at childcare accessibility, this map shows the extent to which children who are using school readiness services are enrolling in high quality care when it's available to them, and the overall infrastructure or capacity to serve young children in high quality settings as measured by accreditation status, or the Gold Seal program in the state of Florida. The dark green areas indicate that parents are enrolling in high quality care at a high rate, and that we have an abundant supply of high quality care in those areas. Areas where yellow color shows that parents are enrolling in high quality care despite the fact that we have inadequate infrastructure. We don't have enough capacity to serve all the families that would be seeking high quality care within that area. And then in our reddish area, we're showing that we have an inadequate supply or inadequate infrastructure to serve the kids who are seeking high quality services, and as a result, children are not enrolling in high quality services. The heat map, or the kernel density clustering, it's overlaid on top of the map, shows the density of children who are using school readiness services in Alachua County. And in the dark purple areas on the map is our higher density areas. Areas that are shaded in yellow are a lower density, but still enough of a density to appear on the map. And then areas that are transparent and are not showing any coloration on top have very few children clustering together in those geographic areas. As we look at this map, we can see that the east side of Gainesville has a lack of infrastructure or a lack of adequate high quality service offerings available for kids, given the demand expressed by children enrolling in school readiness services in Alachua County. We also, in this area on the east side of town that has a higher density of lower income kids, has inadequate access to necessary high quality childcare resources.
So Herman, can I just, can you go back to the slide before that? Yeah. I think it might be helpful to talk very briefly. We don't need a long tutorial, but I think it might be very helpful to say that the voluntary pre-K program, to remind people that that's for 4-year-olds and it's free and it's universal. And then when you switch and you start talking about school readiness, and you're doing a really good job of saying school readiness programs for the MAPs, I think it's important to say that those funds are means tested, right? So not everybody is out. I mean, you have to live at a certain level, right, below the poverty threshold, right, to be able to qualify for those programs. And if I'm not mistaken, the MAPs don't include childcare programs that are in Alachua County that aren't part of this, that don't accept school readiness vouchers.
It does not.
So
in our calculation for capacity, yeah.
I think couching it in that, I think, is important, because we know that providers select away from using vouchers. And that's another form of both disparity and bias, in my opinion, so.
Yeah, and I think that I can highlight that when I get to the provider map,
right,
to show that the blue providers are contracted and are willing to serve children using school readiness services. The pink dots on the map are Gold Seal, or considered high quality providers, who are not contracted and are not willing to accept childcare subsidy.
Right, and that's why I think it's important to educate the audience to those terms that only mean stuff to those of us that live in this every day, right?
Right, yeah, I agree. It's easy for me to skip over. I assume everybody knows it, right?
Yeah.
And then looking at our kindergarten readiness data, Alachua County is ahead of the state averages in children who are ready for kindergarten based on the kindergarten readiness assessment. But still that number is below 60% for each year, which I think falls well below our aims in Alachua County at support, making sure that all children are positioned to succeed in school. And I looked, and as hard as I looked, I could not find that broken out by race or any other way other than just their county numbers. Before we get into discussing the FSA performance in English language arts, mathematics, I thought it was important to share a clear definition of what level 3 performance is versus level 4 performance. Based on guidance provided by the Florida Department of Education, they have defined these 5 levels of performance. Level 1 performance indicates that the child is highly likely to need substantial support for their next grade or course in the subject area being assessed. Level 2, the child will likely need substantial support. Level 3, the child may need additional support for the next grade level. Level 4 indicates that the child likely will excel in the next grade level. And level 5 indicates the child is highly likely to excel in the next grade or course level. And so as we're presenting the next series of data, we will be sharing level 3 performance next to level 4 performance, showing the disparities that exist in our English language arts and mathematics performance. So as we look at 3rd grade FSA scores on the ELA, broken out by race, we can see the performance of Asian and white students is considerably higher than students of 2 or more races, Hispanic or Black students, with Black students at both levels 3 and level 4 performing at a considerably lower rate of success than our other races in Alachua County. This trend continues in 8th grade when we look at English language arts by race, and in 10th grade when looking at these data by race. We see similar disparities when we look at performance based on the student's economic status, which is somewhat difficult to disentangle from racial performance because economic disadvantage in Alachua County is not exactly the same, but is similar to racial status among children and families in Alachua County. Math performance for 3rd graders, 8th graders is similar in mathematics, but when we go to level 4 in mathematics in 8th grade, we are starting to cluster towards the bottom performance levels. Out of school suspension rates we are falling into the 2nd quartile of performance and are higher across all 3 years of data collection, higher in our rates compared with the state of Florida. And the percentage of students that are absent 21 days or more in Alachua County, we range from in 2015-16 a little over 10%. It declined some in 2016-17 and then has jumped back up in 2017-18.
And for some of these, you've included African American versus white. I'm wondering about these last couple of screens since there's such a big difference. Can we get that here?
I think that we looked for that and didn't find that breakout.
So, but we do know that African Americans are more likely to be suspended and absent. So there's some data on that.
Yes, I'm sure there is. I have not had time to continue to search the Department of Education website to get those data pulled out for Alachua County.
The race and equity report that was done by the city, the data is in that one.
This is Maya. I remember looking at that data a while back, and I think it was 3 or 4 years outdated, which is why we didn't include it, but I can go back and double check too.
Well, Herman, Dr. Knopf, if you would just state it in your presentation, even as you went over it earlier, I think that it needs to be on the record that this committee recognizes it. And perhaps the data is outdated, but we certainly want to bring attention to that. I think it's important.
Okay, yeah, I can certainly add that to my comments. That, you know, when we looked at those data and the rates were considerably higher, but we don't have recent data on that and didn't include those data in the report. Does that sound good, Naima?
Yes, and we really have no reason to believe that it's dramatically, you know, gone away since the
Right.
Just add it to your data development agenda to disaggregate it by race. That's how I would explain it.
And then here's our high school graduation rate broken out by race, where across all racial groups, the rate has improved over the past 5 years. But it's still, there's still a disparity present between white children, Asian children, and Black children. Some additional items that we're adding to our data development agenda. And Naima, I will accept Colin's comments and add that breaking out absenteeism and out of school suspension by race to these 3 indicators. And then looking at whether or not all children have nurturing, supporting caregivers and relationships. We're relying primarily on information relating to child maltreatment in Alachua County. And those data are coming from the Child Welfare Dashboard. And looking at the overall population of children in Alachua County, roughly 8% of Alachua County's children have some involvement with DCF. And we'll go through and show these in a closer view to show the different categories of maltreatment reports among young children in Alachua County. So this first chart shows the number of children with allegations up top with the yellow line, children that have had non-substantiated, and that one's not spelled right. Non-substantiated reports, and then children with verified reports. The children with non-substantiated reports have been investigated by DCF, and through that investigation, the families were recommended to participate in services, but there wasn't enough evidence at the time of the investigation to warrant further or mandated action on the part of the parent. And so that children with non-substantiated reports represent that there is something going on within the household or in the child's life that is should be looked at as concern. Breaking out non-substantiated child maltreatment reports by race. Over time, we see that Black children tend to be represented more frequently than white children. And children who have either multiple races or identify as another race are much less frequently reported. And as we look at the different age groups that are contained within the non-substantiated child maltreatment reports, we can see that children birth to 5 are our most frequently reported age group. Children ages 6 to 12 are more, in the middle, and children ages 13 to 17 are the least frequently reported children with non-substantiated maltreatment reports. Turning over to verified child maltreatment reports, and so these are instances where there's verified maltreatment occurring, and these are serious situations for young children. We can see here also that our rate of African-American reports is similar, but still higher than our white student reports until we get down here to the later half of 2019, where we start to see more white children being reported than Black children at those dates. Verified maltreatment by age follows a similar pattern to the non-substantiated maltreatment, where with young children birth to 5 are our most frequent report. Children ages 6 to 12 are in the middle, and our lowest age group is 13 to 17. Looking at the children in foster care per 100,000 kids in Alachua County, we have a higher rate of children in foster care across all 3 years. And are reported as being within the second quartile of performance. Births to mothers without a high school degree. In Alachua County, it's lower across all 3 years than within the state of Florida. If we look at this breakdown by race, we see that Black mothers are higher in the percentage of births to mothers without a high school degree. Some additional items that remain on our data development agenda include items relating to whether or not children are moving from in-home care to out-of-home care, how many of our children have incarcerated or court-involved parents, and the extent to which children are referred for behavioral problems or significant emotional distress. In our final results area, all children live in a safe community. For this, we looked at crime rate data, as well as the social vulnerability index, which I will provide some more explanation on in the upcoming slides. The first slide shows the rate of youths arrested in Alachua County per 10,000. And in the 3 years that we're looking at these data, Alachua County is performing the 4th quartile and is higher than the state rate for youths arrested. Our crime rate for index crimes is also higher than our state average across all 3 years. Our violent crime rate falls within the 4th quartile of performance when compared with state crime rates, and we're higher than the state in 16, 17, and 18. The social vulnerability index refers to the resilience of communities when confronted by external stresses on human health, stresses such as natural or human-caused disasters or disease outbreaks. Reducing social vulnerability can decrease both human suffering and economic loss. CDC's Social Vulnerability Index uses 15 U.S. Census variables at the tract level to help local officials identify communities that may need support in preparing for hazards or recovering from a disaster. The Geospatial Research Analysis and Services Program created and maintains the CDC's Social Vulnerability Index. The SVI is constructed of 4 broad measures of vulnerability. The first being socioeconomic status of individuals living within the community, which include the number of families below poverty, the number of families that are unemployed, the income level of the people living within that geographic area, and the number of individuals with no high school diploma. Household composition and disability looks at the number of people that are age 65 or older, age 17 or younger, a civilian with a disability, and single parent households. Minority status and language includes the proportion of people living within a geographic area that are considered a minority or speak English less than well. And housing and transportation considers multi-unit structures, mobile homes, crowding, whether or not folks have access to a vehicle or are living in group quarters. When we look at these, the Social Vulnerability Index in Alachua County, first, looking at the map, the blue areas, or the lower the index, the better off the census tract is. The red areas or the higher index number shows an elevated vulnerability or risk. And so as we look at this map, we can see that the east side of town, particularly in the center of Alachua County, is at a much higher vulnerability level than families that are living in some of our other areas on the western side, with the exception of the census tracts right here. Additional items on our data development agenda include the number of children in the adult justice system, the number of children who are eligible for a citation or who were arrested, children arrested, referral and referred to a diversion program, and the prevalence of Terry stops or children who are stopped by police under a reasonable suspicion. And again, here are the key insights that our team has identified, and a description of next steps, and that the Children's Trust of Alachua County should take this to determine priority results area or areas that they would like to focus on, and then commission community strengths and needs assessment focused on priority results areas. The strengths and needs assessment should include an appraisal of what is currently known about the community strength finding, and community need finding that would involve communication with residents and community members directly. Resource and network mapping to identify the services that are available in the community that are likely to address the result area that was identified. And then a process of discovering unmet needs and then making recommendations and providing guidance on future directions that will be related to achieving the results as defined.
Dr. Knopf, I had a question just about this slide here, the resource and network mapping. I thought it was brilliant about the availability of childcare and as well as the, people accessing it. So you must have some expertise in that area or can point people where they can go to in terms of the resource and network mapping. I wondered if you had anything to state about that.
Well, I've spent a lot of time thinking about childcare accessibility and been working to develop that measure that I've already shared, but then we're also currently working on some measures related to childcare infrastructure as it's being impacted by COVID-19. I would certainly be willing to talk with folks around other service areas to see if there's some lessons learned that we could share with other folks, but I do not have access to data or information necessarily that would be necessary to conduct that kind of work for other service areas.
Okay.
It's a real challenge. It's been tried a number of times in this community, either through 211 or the United Way, trying to have that whole, that you could call and they could refer you someplace depending on what you needed. And the challenge is that it's always a moving target, right? Because people's ability to take things. I know that the Mental Health Coalition, probably 3, 4, 5 years ago now, tried to do it for mental health services in the community. Wow. And there are so many levels to it and so many different access points that it became somewhat overwhelming to do a resource map and network map. So I don't know whether there is anywhere through either IFAS, the Family and Youth Sciences Department that does a lot of that stuff. I don't know who does any of that kind of work in town in a significant way.
I can ask my colleagues, certainly, if that's where
I don't know if they've done anything through the youth and community science, I don't know, Family, Youth and Community Sciences.
We have faculty coming in, faculty members coming in, one of whom has some community-based participatory research area that she does in after-school programs, but she doesn't start until August.
And I don't know if Dr. Hart, who, she had she did all the heat maps. I don't know if you've seen the heat maps that she did around a lot of those indicators for teen moms giving birth, Medicaid moms giving birth, substance abuse overdoses. That was the start of SWAG, was a lot of overlaying Sheriff's Department heat maps with Medicaid data heat maps, but I don't know that they have anything that they've done around where services are located, but that would be another place to ask. And Dr. Hart certainly still has connections there. But I don't know if they do anything other than on the problematic side.
Yeah, there also are network mapping, their network mapping capabilities to look at how often different social service agencies interact with each other and are reflected in a geospatial sense. And so I'm not an expert in that area, but I know that technology for doing that has advanced significantly over the past 5 years. So I think it would be important to get that kind of on the forward-thinking agenda.
Well, I think that one of the recommendations could be that identify the ways in which we can do that mapping, but that's I think that the needs are more. It seems to me we've identified the needs far more clearly than we thought we might in terms of data and having it. And then doing more of the qualitative and this resource and network mapping thing might be the really more important next step.
I want to raise my hand. I'm going to recommend some changes to the slide because I don't even know what it means to do a needs assessment based on this whole presentation. I just don't know what that even means. I think what you're going to find, I would hope we would kind of stick with our language and that we identify a key data points like third grade reading, for example, and have some, story behind the story and what works conversations, and really pick some areas to do a deeper dive. But to do a community-wide needs assessment, that's exactly where we started before this whole committee started, if I'm not mistaken, where we didn't want to go. Right?
Yeah, that's not how I'm reading this, Colin. I'm not. Maybe because we've been talking about it so much, but well, I don't see this as starting over again. I think what this is doing is looking more qualitatively and doing an analysis of what the community has in place that could be used to address whatever priority the trust board, the trust board has to decide what the key areas are. And I think we have enough information here for that exercise to happen. I think that what we need, maybe we don't call it a needs assessment, maybe we do a targeted kind of look at the gaps of information that remain and do a targeted assessment of those information gap areas, which are the things that he's listed under the bullets.
Again, I'm just reading the words on the slide.
I don't mind getting rid of that.
Well, hey, let's just read the words on the slide. CTAC to commission community strengths and needs assessment, focused on priority result areas, okay? Priority result areas are very broad. In my view, that gets you no closer to where you were before this started. What we want to say is there should be a few indicators that stand out, and it should be very clear. And even if they're obvious, some of the indicators are good and some of them, but we should come back with recommendations that say, here are some indicators that are really going in the wrong direction, and this is where you should focus. And this is where, we looked at all the stuff, all the data, here's some things that are going in the wrong direction, here's what you should focus on, and here's where we recommend you spend more time. Otherwise, I just see endless talking again and getting, so I think there needs to be more specific recommendations. And this is just too broad. This is not a criticism, Herman, of what you have done. It's been very difficult, this whole process, narrowing this down, because there's, such a wide variety of expertise and everyone thinks their area is the most important. But I think there's some obvious things that come out of this just by looking at all that you did, and we should point it out. And I think, and I just say third grade reading because that's just the most obvious. It's been talked about all over the community, and we should immediately connect with the campaign for third grade reading, get everyone together. And if you want to do some network mapping, start there and say, what is everyone doing on third grade reading? What works and what's missing? And that's the way I see it, as a series of small ones. But to say, well, we need to do a community-wide, I just don't want to say we need to commission a huge needs assessment. I don't want that. I want that to go away, because that's kind of where we started when all of this was going. You know, when I listened to the tapes before this started, that we're going to do this great, big, broad needs assessment, and I just don't think that's reality. I've never even really seen that done. Usually, you pick some areas, and
I think you can say, I'm sorry, Colin, I thought you had stopped. My internet is getting, so you break up periodically, so I'm sorry, I didn't mean to interrupt.
If I sound a bit frustrated, we have to move forward from talking about things to making some decisions. And the recommendations need to move us in that direction. And I think we need to pick out some things and give some very specific things that we want to recommend. And I think there's just some obvious things that people have been talking about. I think third grade reading is one. I think it should be in there. The graphs and the things were great. I think, you know, there's a lot of talk about mental health and so kids' social emotional needs and things that connect to that, with suicide and kids hurting themselves and all of this. And we're getting a lot of requests for funding for that. So I think, you know, taking a good look at the system of support around mental health and what we have and what's missing should be on there. I think there's a lot of data to support that. But I think we have to be a little bit more specific in these next steps. Otherwise, I just see endless talking and deliberate. We need to start moving this forward a little bit more aggressively from research and talking to starting to make some decisions. I think Herman's slides on the gaps of quality childcare in some of these areas. What are we going to do about? I mean, what should we do? There's already some talk about putting a center in Waldo that the Early Learning Coalition is. So I would just like to see some more concrete recommendations of next steps to really dig into. And this to me is just broad.
So do we pull the, I don't know, 5 worst indicators and have a slide, regardless of which result area they're in, and put them on a single slide and say, these are the areas where we're the worst? I guess the only hesitation I have, Colin, with us making that recommendation is that it takes the trust off the hook for one of its biggest priorities, which is biggest responsibilities, which is setting priorities. And I think that if it comes out of this committee and what we say is third grade childcare and mental health, without a discussion of, is there a hierarchy among these needs? Is there a prioritization in these result areas? I think that takes the trust board off the hook in a way that I'm not comfortable with.
I think you're totally, well, I would just go back to the, first of all, when you come up with 4 results, if you're going to have fidelity to results-based accountability, one result is not prioritized over the other. It's that this is what kids need to have. If we could wave a wand and make the world perfect, kids would have all of these things, and there is not a priority. Now, as far as what the trust does, I agree with you. It's impossible to say what we should fund or what we should do yet without the additional research. So just because, and I'll just stay on third grade reading because it's on the top of my mind, that indicator is, let's say, going in the wrong direction or we're making no progress, doesn't necessarily mean the trust is going to devote a lot of resources to that, because there's a lot of other resources from other areas going to that already that we may not know about, which will come out in. So I guess the action steps I'm not opposed to. I would just like to see them more focused around some specific areas. And then, so otherwise, I mean, Meg, you tell me, how do you—
back to my point, just list the 5 worst.
Yeah, well, I think what I would change after seeing this is on the graphic slides, a more precise, okay, here's our result for this, and here's 2 or 3 that are not going in the right direction. And then after that, Herman's going to run through a lot of slides, which some are going good and some are going bad. But, you know, not all people on the trust are researchers, and they're going to want to, we're communicating now, and they're going to want to be hit with the things that need to stand out. And yes, people need direction on that. I don't think most people are going to sift through mounds and mounds of data and say, oh, here's what we think. We need to give them a little direction, and I don't think they'll be controversial. I mean, what the trust does with that information and what they fund, that you know, that's wide open. But I mean, the data is what it is, and I don't, you know,
So look at insights. If you look at insights, what would happen, Colin, if the next slide, what we did was say, use those insights and do these next steps.
Yeah. So okay. So there was one. Is this the one where there was STDs? Yeah, ST. Okay. So that was particularly bad, correct? If I'm not mistaken. To me, that's an obvious. So, you know, it may be, you know, yes, we recommend, you know, what's going on here, what's going on in our community. I mean, we have gotten programs in that portfolio of programs that fund things that might address this. But yes, I think people should see that. So here are some things that deserve some extra. I think the recommendations need to be a little bit more pointed directly to what the data said. The last slide is just too broad, in my opinion. Yeah. So I guess, yes, Maggie, I'm agreeing with you as I'm thinking out loud. This is the first time I've seen this.
So take this insight slide. I guess, Herman, the recommendation would be to say in the next slide, instead of doing the community, the broad, in that second bullet, can you go to the next one for a minute? In that, where you now have to commission a community strengths needs assessment, just go to, you know, to make it clear that what you're talking about is looking at those areas, but only with respect to those indicators that were the worst.
Then how does that help us identify strengths? And so I guess I understand and appreciate what you're saying, Colin, but I think that given the previous slide that says the insights, why couldn't we think about, just a comment here, commission a participatory community strengths and needs assessment focused on priority result areas and key indicators in these areas? Don't we want to know what we're doing well, just not what we're doing badly?
Well, I guess
we're only going to fund initiatives where we're doing badly. We're not going to, if we're doing well on, I don't know, the number of mothers who are getting prenatal care, then we wouldn't fund any programs that were related to continuing to support mothers to get prenatal care.
I guess if we're already funding, yes. So pulling away supports from things you're already doing well on makes no sense, because probably one of the reasons why you're doing, I don't see, let me just broad picture, sitting in my non-academic, you know, someone that would be listening to this and then need to make a decision on what's next. What I'm saying,
we're trying to talk to people about those.
I'm hearing there were two different things
and key indicators.
Yeah. So let's, I need an example to kind of talk through this to make sure. So let's pick one, right? So infant mortality was another one that was particularly.
I think Colin, before you go there with an example, I think we need to separate out what we're recommending to be funding areas as opposed to areas where we need further assessment.
Right. Well, I agree.
And I think, is that, I mean, those are two different things.
I understand that, and we're saying the same thing. So, but ultimately we are moving towards funding decisions. And like I said, we may find an area so mental health is one, right? So we may find mental health is an area that is not going in the right direction. I have to use a concrete example to think, right? So some of the mental health data, right? Ultimately, what we might find out is we get the community together, we're doing this well, we're doing not well, we have a gap here. But filling the gap may not fall in an area of the trust. So I'm agreeing with you. All of the stuff you said is important. I don't see how this slide gets me there. It's just too, what this says is we're to do a big, huge, community strengths and needs assessment. Maybe it's multiple. Maybe it's pick a few areas. I mean, so I'm having problems with community strengths and needs assessment, because to me that sounds a lot like where we started. If you listen to all the stuff, remember we're going to spend $300,000 doing a big community needs assessment. I have never done that before. I have always done various little studies and assessments based on targeted focused areas and based on what the data said. And so, and I'm not seeing that here. It's throughout the report.
So Colin, what if instead of the commission a community strengths needs that you focus on part, you say commission a targeted strengths and needs assessment based on focus on the priority indicators identified?
Yeah, or I would say, here are some areas for further study, and I would list. Why is there a hesitation to list specific? Is there, or maybe I'm hearing it wrong. Is there a hesitation to pull out specific indicators from the report and suggest these are some areas that require further study?
Herman, how does that relate to our charge?
In what way?
I'm sure that's our charge. I guess I, wanted to look back at that.
Well, yeah, I mean, our charge did not say that we need to come up with a list of areas that the trust needs to focus on for the next year. Our charge was to identify indicators that we should be tracking over time, identify the data agenda, and we've gone further than that by identifying the key insights. We've identified some potential next steps. I mean, I think that if what's holding Colin up is the community needs assessment, then I think that we can change that terminology. My view of what I wrote there was that this would be guided by the priority areas identified by the trust.
And the
as areas
indicators.
of concern, right? And the indicators, right, that were problematic. And that it's considered, I'm calling it a community strengths and needs assessment because we want to hear from the community related to these indicators, not just rely on administrative data that we're able to pull.
Totally agree.
And so that my use of the word community did not necessarily mean that we're going to go back and kind of do a full needs assessment on all of these results areas at once, but that it should be informed by the priority areas that the trust decides these are the indicators or these are the results area that seem to, if we were to address this results area first, it might have a meaningful impact on the other results areas. Is that the difficulty with looking at impacting the lives of children and families is that these services relate to each other. And so that if kids have access to good health care, they're also likely going to be able to go to school and make good use of the educational opportunities they get because they're feeling well and their teeth have been taken care of and they have access to adequate nutrition. Kids in after-school programs are less likely going to be involved in the kind of behavior that might result in STDs if they have something else meaningful to do with their time outside of school instead of shacking up.
So can I make a suggestion to see if we can move this a little forward? How about if you, behind your insights slide, add a slide that has the worst indicator for whatever, for want of a better way to put it, for each result. And then in the needs assessment, say a community-focused needs assessment. So instead of a community needs assessment, which makes it look like we're redoing the whole thing, a community-focused needs assessment that reflects the areas that were identified as the most vulnerable.
I mean, it might also.
And the commission has, or the trust has to have that.
Did Maggie drop off?
No, I'm here.
Oh, I'm sorry. I didn't hear the last part of what you said. Could
So,
you
so
repeat?
then change the community needs assessment piece to just say that it's community focused. So it's clear that what you're doing is reaching out to the community, see what strengths we have in those areas that we see the most vulnerability, because there are going to be strengths even in those areas, and fill in those gaps that way. And it's just changing some words and adding kind of a concentrated slide or two that says, for these 4 result areas, here are the most scary things going on. And maybe as you go along in the presentation, you can, and you did as you went through, pointed out where the areas of strength were. You know, we're higher than the state on this, we're better than this. This is a high percentage.
I think pointing out the strengths is really important too, because I think that that's going to be a different mindset for some people. So identifying, maybe in a summary way, identifying some strengths and some needs areas, so they
That'd
can
be great.
they can look
Yeah.
at what we are doing really well, but also know what we are needing either more targeted information on to help understand the issue better. And our strengths might turn out to not be strengths because, you know, there might be flawed data. I mean,
I think that's a good
don't
way
tell
to
the whole story.
I need to sign off, guys. I'm sorry. I've got another call. I've got to get on it in a few minutes. But Herman, I just want to say, for all of this feedback you're getting, it is a really wonderful slideshow and a really good presentation. And you're very, very, very good at delivering it. And I think you've got a lot of great insights to share. So, I mean, thank you and Maya I know what a phenomenal amount of work this stuff is to do. And so I just want to say thank you. And I think those last 2, I love Maureen's recommendation. Put in a slide that says, here are where we found strengths. Here's where we really found weaknesses. That's where you need to focus your targeted assessment on. Thank you.
Thank you, Maggie.
Bye, Maggie.
Bye.
Bye.
Yeah, Herman, can I just read 2 things on the charge and let me just get your opinion? So where it says existing data and information that can and should be used in identifying community strengths and needs. So we have definitely fulfilled that, correct? I mean, there's no question. Okay. Important areas currently lacking comprehensive information that need additional data collection. So the data, is it your opinion that we have fulfilled that just by giving them a data development agenda? And so in those 2 things, we will have, it's the second one. It's the second one that I'm, you know, I think that where I am different from the group here, but how did you interpret as us fulfilling that part, number 2?
I thought that the identifying items for the data development agenda was what we were charged with doing there. I mean, I think that if we want to clarify, you know, some particularly strong areas of strength and some areas of concern on this next slide that leads into the next steps. So then this slide would be, I still think that the trust needs to determine their priority.
Okay. So
because they can't do everything at once, right? So they got to decide, what are we going to do first?
So Dr. Schneider, as a trust member, when Herman says identify our priorities, do you expect that someone will make a motion for the trust to adopt those 4 result areas as a start? I mean, I'm just trying to figure out what's going to happen.
Yes, I think that the trust has not agreed that those are the 4 priority areas. And so I think the trust has to agree that those are the 4 priority areas. I think, as somebody said, maybe Maggie, I think the trust also has to work in collaboration with you and others to think about what are the important indicators. But in order to make those decisions, I still think we need to find out a little bit more information, right? And there may be, as I keep saying, there may be other indicators that rise to being more informative and useful than like 3rd grade reading level. I mean, we've been using that for a really, really long time. And as Herman said, we're not seeing any changes. And as you said, we're not seeing any changes. And if there are a whole lot of people working on it, then why aren't we making changes? Well, I would guess that it relates to a whole host of other indicators, like Herman mentioned, that if you're in school and your teeth hurt and you're unhealthy and you're living in poverty and all of those things. And so we can't fix all those things, but I don't think we can move one indicator with just by addressing one indicator. And so I guess that's why I think it's important to think about across systems and how to build connections across systems that the trust can do, rather than just zeroing in on an indicator that doesn't take into account those 5 result areas. That's just my perspective. I think we have to think about all those 5 results areas and key indicators underneath them, and how those intersect and interrelate to each other when appropriate.
Well, nothing you said I disagree with. I just,
But I would say on the bottom column, what I would say in that last slide is, Herman, make it say results and key indicators, so that we can move forward rather than, I couldn't agree more with you, Colin, about talk and talk and talk and talk and talk and don't do. But doing, I think we want to do in a different way from my perspective. So how do we incentivize collaboration that will move the needle on an indicator in health and an indicator in child well-being simultaneously? And the reason I think Maureen and Herman and Maggie and others on the call feel like it's important to talk about just strengths and needs is because we've had a lot of large-scale needs assessments done in this community that have pointed out all the problems we have in Alachua County, and not really pointing out where there are areas of strength that we could build on.
Right, and I mean, Pat, I very much agree with you. And I think if we choose these indicators based on the data provided, we'll miss some important things. And I think that's what you're saying, right? I mean, because, and the way people might work on it or think about working on an indicator will be very different across trust members, I'm assuming.
But just getting the results approved, Colin, will be a major accomplishment. And then moving to the identification, from my perspective, and then the identification of what are the key indicators that we're going to start with. I have to take this 4:30 call, so I apologize. Is there anything else we have to?
I think you need to take a few public comments and then vote to send this to the trust with the changes you recommended, and we have them recorded. But I do think you probably need to do that.
Yeah. Do I hear a motion to approve?
So moved.
Second?
Second.
Any discussion?
I'm sorry, who seconded it? I'm sorry.
Kate Fogarty.
Okay.
Thank you.
All in favor?
Aye.
Any opposed? Hearing none, the motion carries.
Thank you, Herman. It was fabulous. You did a
Herman,
great job.
Yes,
Yes,
great job.
yeah, both. Thanks.
Well, thank you all very much for your feedback. I appreciate it.
Before you adjourn, could you just ask for any public comment if there's anyone here on the public?
Yeah, do we have any public comment?
This is Sherry Kitchens. I just wanted to echo some of the comments that were made earlier. One about the amount of work that went into this and how much I appreciate how hard this group has worked together and how Herman has kept everybody kind of on task with it. I also wanted to mention a lot of the issues that children are dealing with regard to school success, school readiness, and things like that are a lot more complicated than that data shows. So I also really support the idea of when these data points are presented to the trust, that it is clearly explained that there is a lot of crossover, and a lot of our kids that are in the juvenile justice system are the same kids that have been abused, that are the same kids that are living in poverty and struggling in school. And so we don't have a good way to capture that kind of crossover data. And it'd be great if we could figure out some maps that would lay on top of each other that would show us this, so that we could really focus on some of those kids that are impacted by multiple systems. When we work with children who've been abused, the impact of abuse and exposure to violence takes years. It's not like ours is like the snapshot. This happened, this year we have this % of kids, but we had about the same amount of kids last year. So it just starts compounding upon it. So we end up having a much larger group of children who have been impacted by violence than just the ones who were identified by reports that year. But the crossover between the social problems that children and families are dealing with is significant, and we don't really have a good way of capturing that kind of information. So when we're looking at the data, we have to have some statement that addresses the complexity of some of the things that these children and families are dealing with. And the data points themselves are great, but if we focus just on the data points and the programs just working on that one population, we're really missing the boat here. But thank you for the opportunity to speak.
And also just a big shout out to Sherry for working late into the night to help me pull together the data for the maltreatment results area.
My pleasure.
Any other public comment? Okay, is that the last agenda item, Colin?
Yes, it is. Thank you. Great job.
I guess we need a motion to adjourn.
So moved.
Congratulations.
Any opposed to adjourning? All right, well, thank you guys very much
Thank
for
you,
your work on
Herman.
this.
Thank you, Maya. Thank you both. And, I think it's a really good presentation. It's just a process, right?
Yeah.
I understand.
Well, thank you to all of you guys for your help and support in this. And we'll look forward to sharing this with the board on Monday.
Yep. Okay.
All right, thanks, guys.